right, well, good afternoon, everybody. My name is Paul Pettit. I'm the Public Health Director for Genesee and Orleans County, and it is Friday afternoon, and we're bringing you our 4 o'clock briefing, as we've been doing for the past couple weeks here. So, again, this is an opportunity for us to interface and have some back and forth dialogue around what's going on locally here in Genesee and Orleans County. We do believe that this is very important, that we continue to provide you the most relevant, updated, current information that we can. So again, we're glad to be able to do this. Again, you know that we're putting out daily press briefings, again, with updated numbers and the information that we believe is very important to our local residents here in our counties. So as we get going today, I do want to first just take a minute and thank all of our residents, thank our first responders, thank our healthcare workers, our public health professionals, all of those that are really working hard and coming together during this very difficult time. It's very refreshing and rewarding just to see all the effort there. I have the privilege to sit in on many different meetings and planning sessions, and I'm here to tell you that there's just so much activity going on, so many people wanting to do great things to help out neighbors, to help out loved ones, to help out the folks in our counties, and it is just humbling to be able to be part of that. And again, we're just encouraging folks to continue to look out for and help your neighbors as we move along. Together, you know, we're in this together, and we'll get through it together. So again, on behalf of myself as a public health director and the other county, we just want to thank you all for your continued patience and understanding during this difficult and unprecedented time. None of us want to be doing what we're doing. We do know that, but it's going to take us all being compliant and working collaboratively and adhering to the guidelines to make sure that we get through this as quickly as possible. So as I've done in the past few weeks here, we're going to be providing a situational update again, looking at the numbers, currently what's going on here in Genesee and Orleans County. And then I'll provide some situational updates on a few other activities that are going on relevant to swabbing and some other things pertinent to our communities. And then there'll be some time for some questions and answers. And again, if other county officials are on and they'd like to comment or answer any of those questions, it'll be available at that time. So as of 2 p.m. today, and again, we use a 2 p.m. cutoff just as an opportunity for us to make sure we're getting the most accurate and vital information out to folks that we can. Genesee County has received 4 new positive cases. Again, that's 4 new positive cases of COVID-19 for Genesee County as of 2 p.m. today. 1 under the age of 65 residing in the central part of Genesee County, and there's 3 under the age of 65 residing in the eastern part of Genesee County. In Genesee County, the 4 positive cases were previously under mandatory quarantine and have now tested positive for COVID-19. They are now under mandatory isolation at home. So all 4 of our new cases were under mandatory quarantine and are now under mandatory isolation. In Orleans County, 3 new positive cases of COVID-19 have been reported for a total of 9 cases in Orleans County. Again, with these 3 cases, all 3 reside in the central part of the county. 1 is over the age of 65, and 2 are under the age of 65. 1 of the 3 is under isolation at the hospital, at a local hospital, and the other 2 are under mandatory isolation at home. None of the Orleans County positive cases were under precautionary or mandatory quarantine when they became symptomatic. So again, these are 3 new unrelated and unidentified cases in Orleans County. Contact tracing has begun for all the ones that I mentioned. Known contacts have already been placed under mandatory quarantine and will be swabbed as indicated if symptoms become present. At the moment, that is not. We're continuing to follow up and identify those potential close contacts, and we do feel we have a very good handle at the moment on any of those that we've identified. If a person or a contact is identified, they will be notified by the county health department and quarantined if warranted and swabbed as indicated. Again, we're again holding back on some information. I know that some folks have been asking for and wanting, and again, we do have HIPAA regulations. We do have, again, privacy HIPAA rules that we have to be cognizant of, so we're not able to release information above and beyond what we're doing at the moment. If and when there is a situation when there's a potential contact that's made in the public, where it's a public location and we don't feel we have enough detailed information from the positive case to identify someone, we will open it up at that time and again, note potential location and time frames of when the person may have been in that location. Again, to date, we have not had to do that. That is why we have not reported any of those in the papers and looked for additional contact. So again, that's a case-by-case basis, and it's really driven by the facts of the investigation as it plays out. So the next thing I want to do is move over to cumulative data. So we've been reporting a little bit of data as we've been moving along, not just situational, but as we've been collecting data over time. And today I'd like to announce that we do have a new mapping platform that we're going to be launching today. I'm going to have Mary share the screen here, so that should be available to all of you to see as I explain what we're doing here a little bit. And this is something that we've been working on, and a big thanks to Genesee County Planning Department, Erin Pence specifically for her work on this. She's been working with us over the past week again to get this stood up. And this is somewhat similar to what you may have been seeing in surrounding counties, again, tracking the number of cases, number mandated, under mandated quarantine, isolation, etc., along with a map. And we felt it was time to try to get something stood up like this beyond just reporting the numbers, which we will continue to do, but we wanted to put out a somewhat of a pictorial diagram, etc., that folks could reference and have more of a easy snapshot view. So moving forward, we're going to have links on our websites available where the public can click on this site and be able to actually see somewhat real time of what's going on in our counties. I'll explain the map just a little bit. There are options here. We built this so you can actually look at one county individually. So up on the upper right-hand corner, there's a drop-down menu where you can select Genesee, Orleans, or both Genesee and Orleans combined. And as you click on those different features, it'll change the numbers and the data accordingly, so that you'll be able to see exactly what's going on in whatever view you'd like to see. So we felt that was important, again, for folks that just wanted to hone in on one county or the other, or like to see what's going on in our two-county region. And again, there's some different clicks that you can focus in on the left-hand side that talk about total case counts and active cases. So again, these are ones that we currently have under observation, and what's going on currently in the county is active, and then there's the ongoing or the total, which is to date any COVID-19 activity. So again, you're able to click on those as you move along and really get a good real-time view of what's going on in our community. So we're very hopeful that this map will be helpful to folks and that people can look at this. Again, from the real-time standpoint, we are updating this once a day anyways at the moment as time allots. So when we do our daily reports, this map will be updated accordingly to coincide that at 4 o'clock. And it's going to be on the weekdays at the moment, so on the weekend, we're not going to see these updated unless, again, we have additional capacity to move those numbers. But they will provide as real time as we can get at the moment, and we're hopeful, again, this will be helpful. And as you can see, we've kept the map into the 3 different categories, east, west, and central, as we've been reporting the numbers. I will like to say that as we get more numbers, as we start to see more positives in our community, not something we want to see, but we know is coming, we will be moving more towards putting those into individual towns as time moves forward. But at the moment, we're going to stay in those 3 buckets for both counties. And that will change over time. You'll see that as we make that determination based on, again, the number of positives in our community. So again, that will be available. So hopefully that'll be well received. And if you have any feedback, feel free to let us know on that. So also cumulatively, some data, it's up there on the maps for you to see. But for Genesee County, again, 21 positives to date. We've had 219 negative test results. So again, we're running at about 10% of our testing is positive for COVID-19. We have 18 folks under mandatory isolation, 38 under mandatory quarantine, 11 under precautionary quarantine. We've had 1 death, and we have now 2 that have recovered. So again, that's another important number that we're tracking. These are folks that are moving out of isolation. They've now over into the recovered category. In Orleans County, we have 9 positive cases, 132 negative, 9 in mandatory isolation, 13 in mandatory quarantine, 5 in precautionary quarantine, no deaths, and none recovered. So again, please reference the map. We're going to continue to put out in narrative form our daily press briefing updates during the week, but now there's a couple other formats you can utilize to get that information. Again, our healthcare providers are advising patients to undergo swabbing that are symptomatic. Again, we're encouraging folks to call ahead, and screening is still being done at all the healthcare providers and by the healthcare systems. We're still focusing on our high-risk populations. Again, those above the age 65, the seniors, or older folks, including the immune compromised and those with underlying health conditions. So unfortunately, we're still not in a position locally where we have enough swabbing kits available that we can open this up and offer it to anybody who's symptomatic with respiratory issues. We're still very frustrated by this. We're continually working with emergency management to try to get these supplies into our region and to our county specifically. But until that time happens, we're still focusing on triaging and screening based, again, on our highest risk populations. So, as more comes along that and we do find out additional information, we will be passing that along. All right, so just some operational updates to go through. We're also working on a couple of different ways to try to get out more messaging to the public. So we started a Go Health Minute campaign. So we're going to be pushing out some different PSAs and information by county officials, by different healthcare workers, community-based organizations, private businesses, public, anybody that would like to participate in this. Again, encouraging folks to practice social distancing, washing hands, staying home, calling ahead of sick. Again, all these common talking points that we've been going over and over and over again. We do know that as things start to pick up and we start to see more positive cases locally, that the more we can push out this messaging and the additional formats that we can do it in, the more hopeful that people will adhere to it and be more aware of it. So be aware of that. So we're going to be working on that campaign coming up over the next couple weeks here. Social distancing really needs to be practiced. This is something that we've been talking about, and we can't reiterate enough the importance of this. I know it's onerous to some people, it's difficult, none of us want to be doing it, but it is the way that we're going to be able to get through this as quick as we can, and it's healthy, and hopefully with the least amount of cases, and hopefully minimal deaths as we move forward. And this is something that we all have to practice, we all have to participate in. And we just need to, again, work with our neighbors, work with our community members, our different towns to really put in place and to really adhere to these different guidelines that have been put out there for us to move through this situation as quick as we can. Obviously this includes playgrounds. I know many playgrounds have been closed fully or different components of playgrounds and basketball courts, tennis courts. We're getting a lot of different calls. And again, I know a lot of people may not understand or like to hear this, but we're trying to minimize and keep folks apart from one another. This is the best thing we can do during this time, as we don't have antivirals, we don't have a vaccine, we don't have ways to really combat and treat this. So our best medicine, our best thing that we can do is social distance and keep away from one another as best we can. So again, if you are going out, if you're going to stores, make sure that you're keeping your 6-foot separations from one another. Make sure you're frequently washing your hands and taking the precautions that you need to protect yourself and to protect others around you. Along that, we are coming up on a holiday here, Easter, that I know is widely celebrated and something that we all enjoy, gathering with family, attending different faith-based services, and it's a very important time for a lot of us in our lives. And coming up here shortly, in less than 2 weeks now, I just want to take a quick minute just to encourage folks that, we still need to be able to function and to celebrate and to have these different special times in our lives, and this one's going to be a little different for folks. I'm encouraging people now to take time to plan ahead, to think about how they may be able to do different dinners and things in unique ways. Maybe it's through Zoom meetings or Facebook Live or different things with your family. But again, we want to try to keep people apart. The last thing we want to do is have COVID-19 investigations coming out of family gatherings where 20, 30, 40 people got together and celebrated. Again, a great thing to do, but the timing for that is not now. I know it's very frustrating and challenging, but we're really looking for people to, again, listen to this guidance. So think ahead. Think of different ways that you can be creative to celebrate together. It's more smaller core family units and maybe bigger through social distancing, social media, etc. So, again, be thinking about that as that's coming up quickly. Again, we just want to remind folks to stay home if ill. Again, we can't reiterate this enough. If you have any type of respiratory illness or any illness in general, you need to be staying home. Do not go out to the stores. Do not go around the community. Call your healthcare provider. And again, based on the screening criteria, hopefully we can get folks swabbed and tested for COVID-19. Also, if you work with a vulnerable population, again, one of the ones we mentioned, it's very important that you self-monitor, that you're not going to work while symptomatic. Again, these are our folks that are our highest and greatest risk, so it's very important that we're making sure we're protecting them as best we can. So if you do work with those folks, again, any type of symptoms, stay home, call your place of employment, go over, let them know what's going on, and they'll work with you on that. It's just very important that we protect folks, and if you are working, you remove yourself immediately from that environment, and again, let your supervisor know, and we can go from there as far as getting you swabbed, etc. Again, older adults, we've been talking about that with our snowbirds coming back, just again reiterating the fact that we want people to be very cognizant that when they come back, things may be different here in New York from where they're coming from. Not as many states have obviously the significant outbreak that's occurring here in New York. Our regulations may be different, the different recommendations and guidelines. So again, if they're your loved ones, your family members, your neighbors that are coming back, take some time to talk to them, again, over the phone or maybe across the yard, not too close together, letting them know of some of the different requirements, and be a good neighbor. Help out, get them maybe supplies and foods that they may need, again, to help keep them out of our grocery stores and out in the community as best as possible to protect them during this time. Another thing, just a cognizant reminder, is we are hearing a lot, again, about different types of scams that are occurring. We know our seniors can be susceptible to these sometimes, but it is impacting everybody. And, unfortunately, we have bad actors that want to take advantage of crises and different situations, especially with the stimulus funds and the money that may be coming out. So just be very careful and cognizant of your own personal information. Do not share that with anybody, and do not, make these phone calls and give out information. So we just want people to be heightened to that and be aware of that moving forward. As I start to wrap up with the notes that I wanted to share anyways, we are, again, asking our folks to be respectful, all of our residents to be extremely respectful and thankful for the hard work that our healthcare workers are doing. They're out there, they're doing their best to help those in need in times of crisis, and it's just very important that we show them respect, we treat them with dignity, and we make sure that we're doing all we can to thank them during this time. The long hours that they're working, the way that they're putting themselves at risk to deal with positive patients and folks that may be dealing with health issues here. So again, they're out doing their job to protect you and protect our community, so let's make sure we treat them with dignity and respect, and treat them the way that they should be. Lastly, again, anxiety, fear, depression, they're all things that come along with this type of situation where people have been staying home and social distancing, and they're not feeling they're getting the social supports and other things they may need. There is, services out there and available. Make sure you take advantage of them. Those are, again, posted on the daily briefings, the different care and crisis helpline number, and I know our local behavioral health units, et cetera, are available for those that may need additional folks to talk with. So make sure you take advantage of those if you're feeling desperate, feeling anxious. It's fully understandable. You're not abnormal. You're not weird for feeling that way. And there is help for you out there, and we want to make sure you get that so that we can all get through this together. So as I wrap that up, again, we're in this crisis together. We need to collaborate and work well together and make sure that we're doing our best to help each other out and help us get through this. So with that, I don't know if Shelley or Lynn or Jay, Jack, any of you guys want to say a few comments. If not, we can open it up for questions from the press.
So, Paul,
I have a question.
I just wanted to echo what you had commented about the social distancing. And I think that it's really important for folks who continue to travel to and from work, maintain that as much as they can at work, but be even more cognizant once they are at home for who they've interacted with at work and who they're interacting with at home. Are there special maybe guidelines or guidance that you can offer those who are out in the workplace and how to best protect their families?
Well, I know there's different guidance documents that are out there, as far as when folks come back home and making sure, again, that depending on what work setting you're in, but potentially, removing your clothes, taking those off, showering before you go into the home, and obviously, being in contact or touching surfaces within the home. Again, significant hand washing is very important. But, again, when people are coming back that may not have been, and you're coming into a home environment where you may have folks might be a little more susceptible or in our risk population, again, reducing again, bringing the virus in is important, and I think along those lines of, again, cleaning those clothes, washing hands, taking showers, and keeping that spacing within the home is very important. Continuing to wipe down common surfaces in the kitchen area, vacuuming, wiping things down, bathroom areas, very important, those common use spaces to, again, keep the virus knocked down as best you can in the home.
Paul, this is Dan Fisher of BTA. Of the 21 total positive cases now, can you tell us, A, how many of those are hospitalized, and have you experienced, heard of problems with supplies you need medical facilities?
I didn't catch the last part of that question, Dan. The first part on the Genesee County side of the positives that are currently under isolation, they are all being isolated at home. We do not have any hospitalized at the moment in Genesee County.
Okay, that's sort of it.
Paul, Gary, may I have a question? Paul, can you hear me?
I'm sorry, it's really choppy for some reason. I'm not getting the question. Maybe you could type it into the chat box.
Can you hear me now?
Yeah, that's better.
Watching the news, both local and national news, there's a lot of discussion whether people should be wearing masks or not, and whether that should be mandatory or not, like some executive order or whatever. It's a two-part question. One is, do you have any comments with regards to that? Second is, if they do make that mandatory, where are people going to get masks? From my understanding, it's even healthcare workers, some areas don't have enough masks.
Yeah, thanks, Gary. This is a evolving situation. Obviously, the guidance has shifted a little bit from when we talked. Been talking over the last few weeks here. Again, it's my position on it really hasn't changed from last week on how masks work and how they benefit folks. Again, when we're talking about your common use surgical masks, those again are for those that are symptomatic, patients, et cetera, to put them on, and they're very thin layered. They essentially are keeping any type of, spit, spray, nasal, anything coming out of your mouth or nose from leaving and being projected forward, right? So that is where, again, the benefit is with those. And, part of the recommendation around the mask usage now and wearing masks is, as we know more about this virus, we're learning that they're saying about 10% of folks potentially could be contagious and shed the virus while asymptomatic. So again, not showing any other symptoms, and together there's debate whether they're asymptomatic or their symptoms are so light and not viral enough that you might notice them, like a really, really low-grade fever or just a bit of a cough that you're not really registering yet as being symptomatic. But either way, again, if folks are asymptomatic, if they're out in the community walking around, going to grocery stores, etc., the general thought behind the mask is if folks are wearing them, that will help protect and keep anything, if the person is COVID positive and symptomatic or with any other respiratory illness, from potentially spreading that around to others that may be somewhat near them, again, hopefully more than 6 feet away. So again, that's really the point of the recommendation there, is to help guard and protect other people from you if you may be potentially asymptomatic or symptomatic, and protecting others. It is a bit of a challenge because, as you just mentioned, and we've been talking about, we do have shortages around here. Masks are not widely available. And I think, again, if you're looking at some of the narrative on the national news or state, it's around being creative, using buffs, different scarves, any type of barrier to potentially wrap around your face, your nose, or et cetera, to, again, try to keep any type of spray somewhat enclosed. So it is a problem, and there is not, as far as I'm aware, readily available masks for folks in the general community to be able to go buy, to get. They're still, again, backlogged on any ordering sites that people may order them from. We're still challenged in trying to get them ourselves into our healthcare systems and in the health department. So, again, the recommendation may come out that they're going to ask folks to start doing that. If you have and you're able, as we talked about last week, anything is better than nothing, right, when you talk about protecting and covering your face up. So, but, again, that's kind of an evolving potential recommendation.
Thank you.
Yep.
Hi, this is Mary Kickenbach for the Daily News. This recently, earlier today, Como had mentioned that there was an executive order talking about about taking ventilators from upstate to assist with downstate. Is there any concerns about not having enough to treat people locally, and can local officials do anything to stop or limit the removal?
Yeah, that's a great question. Obviously, this just came out at his press conference today. As we've been talking about, he seems to be kind of writing the script from his press briefings on a daily basis, which, again, puts us in a very precarious situation across the state, especially for the localities who are trying to respond to what he's saying. This is very concerning to myself. I've talked with Dan Ireland at UMMC and, talked with some of our emergency management folks. Obviously, taking and removing any level of our respirators, removing any PPE that we have from our region or any region within the state is definitely something that we have grave concerns about. As you know, as we've been reporting for several weeks now, we have been trying to get more PPE. We're burning through it. Our healthcare workers are going through the masks, the gowns, the goggles, the face shields. We need those supplies in our region. We also know that, the virus, and as far as, the trend and where the apex may be, we seem to be a couple weeks behind downstate as far as the type of numbers that they're seeing. If you look in our region, Erie County, they're going to be up over 900 cases, we hear today, over 1,000 probably by tomorrow. Again, Monroe seems to be increasing exponentially, and if you look locally with our numbers, again, 3 new in Orleans, again, those are all starting to trend up. The last thing we want to do is get in a situation where our availability of PPE, respirators, any of those things are not available for us when our peak and our apex comes within the next couple, 2 to 3 weeks, as potentially predicted. I understand what the governor is trying to accomplish, and that they have the need down there right now. But I don't want our communities to be in a very precarious and unfortunate situation that when ours comes, we don't have the type and level of respirators and PPE we need to respond effectively to help keep our folks and our residents in our county safe. So it is a big concern. From the legislative side, I've heard that our local reps, our senators and assemblymen, they are writing letters, obviously pushing back on this plan. And, hopefully that we can come up with some compromise around this where we're not going to be put at a detriment in our ability to respond to protect folks at the benefit of others.
Howard Owens with Batavian here. I'm going to have a couple of questions. I did want to throw out just on the mask issue. We brought this up in our own publication. Dozens of videos on YouTube about how to make your own masks. They may not necessarily be medical grade or whatever, but as you said earlier, I think something's better than nothing. That's the approach I'm taking. On the kind of the PPE issue and the protective gear, just give you a chance to weigh in on a thought. The governor again, called on state manufacturers and the idea we should have enough resources in the state to be making PPE. Anything you want to say about this is making that?
You're breaking up on me. I can't hear the question. Sorry.
Did you hear me? Did you catch any part of what I said? I'll type my questions in.
Yeah, sorry, Howard. I can't hear the question. You're breaking up.
So while Howard is doing that, this is Shelley Stein again. Paul, the modeling and the mapping that you have for us is available 24/7 because it's a website. Is that correct?
That is correct. That'll be available 24/7. Anybody can check on that. The one thing just as I mentioned, we're going to be updating that, again, once per day and not necessarily on the weekend. Depends on availability to make sure. We want to make sure the data is correct. So that's first and foremost the important thing. But that will be available 24/7 for people to reference. That is correct.
I wanted to say that that information really demonstrates the fact that it is not just one place in our county, that it is everywhere. So everyone really needs to pay attention about protecting others. It's not about themselves. It is about protecting others in our community and in our network. And so having that up is just a tremendous piece of factual information. And thank you, and thank our planning department for the work that was put into that.
Yes, agreed, Shelley. And just a note to piggyback on your comment there. Again, people are focusing on addresses and they want to know what town specifically. But as you can see by the map, and no town is exempt from this. It is widespread. It's community spread in our community. And we really don't want folks to hone in necessarily on the map as much as the data. That's there, and really understand that it is everywhere. It's widespread. It's community spread. People are picking this up potentially anywhere and from anybody, which is why we need to really continue to push on social mitigation and social distancing. Local production of. So Howard, your question was around PPE and ramping up local production. I guess as far as getting and receiving PPE, we keep obviously putting requests in through emergency management. I mean, that's our process for receiving that locally. I don't know if you're referring to manufacturing our own PPE. I guess that's not something that we're directly involved in. Again, I think you referenced potentially some different ways that homemade PPE can be made, masks, etc. Again, not medical grade, but as we said, potentially anything over your face to protect and saliva, etc. from being expelled forward would be something that could work. Again, there's different ideas and concepts out there of what could be done. But as far as local manufacturing, again, that could be something that local businesses in the area that have the capability to do those type of activities, that's something they could definitely potentially engage in if that's something that they're interested in. So the question was around false positives and potentially up to 30%. I guess I haven't seen that report, but with any type of test, there's often false positives, false negatives on both sides, and it may be a result of how the swab was done. It wasn't captured quite properly. They didn't get enough nasal fluid, etc. When they took it. That it's not coming back with an accurate reading. So anytime we receive those reports, obviously it's something that we need to consider when we look at the impact locally. Again, when we look at what's going on, if the person's symptomatic, again, regardless, I guess, if they're positive or not, they need to be home. They need to be isolated and not around others if they're symptomatic. So I assume if they were getting swabbed, they had some level of symptoms, again, whether it's fever, cough, tightness of breath, shortness of breath, etc. So again, in that case, we want people to stay home. We want them to self-isolate and work with their healthcare provider. Again, and it may be a need where they might need to get re-swabbed as part of that process. But again, this is unfortunately something we see with any type of testing. It's not a foolproof method, which is why, again, we need to hone in on the symptoms part of that assessment process.
Paul, hello, it is Tom Erders. Howdy. I wonder how many ventilators are in the two counties right now between Medina and United Medical Memorial. And I wonder how many are in use. And, in terms of the governor determining what is excess.
Yeah, so the last number I had, Tom, was 11, I believe, between the two counties, which, as you can imagine, is well under the potential need. If things got as bad as potentially projected, again, we're going to err and be optimistic that we're not going to get that number because we're doing such a great job of social distancing and keeping away from one another. But the reality is, we do obviously can put requests in and asking for additional ones. UMMC is affiliated with Rochester Regional, so they do have a potential pipeline that maybe get more. But again, Rochester and Rural County are going to be dealing with high numbers themselves. I do not have a number of how many are in use currently. We do know, obviously, we still have positive flu cases and other respiratory illnesses going on. So I'm sure there is some utilization going on right now in our healthcare systems locally. But again, that reiterates why we don't feel we have any excess that we can offer up and downstate, unfortunately, from them at the moment.
Well, it seems like a tough dilemma if the National Guard shows up. I wonder what the options are, really.
Well, that's a good point. We can't really speak to that beyond, we can push back to say this is not something we're in agreement with, and the reality is, not only the healthcare systems, but the health department and other responding agencies, we do pretty much daily surveys to the state, letting them know our number of PPE, number of ventilators, number of masks. I mean, that's something that we track, again, to try to keep an idea of how much is in each community, so they can, again, push resources around. So it's one of those things the state knows where all the respirators are. They know numbers, they know utilization. And I guess I don't have a good answer about what we're going to do when the National Guard shows up to take them. Again, hopefully we can have some reasonable conversations and try to figure out a way that we can balance this request and need, and that everybody can somewhat share the availability that we have to make sure we're protecting all of our folks. And again, we're really focusing on our two counties here.
You mentioned. Okay, go ahead, Jay.
Thanks, Tom. Paul, wouldn't you indicate your experience, and I think the same with Tim Yeager, is that when you have a state declared states of emergency, as we do, both right now at the state level and even the federal level, when they employ and deploy the National Guard, locally that has taken certain authority and or ability to, shall we say, resist, or whatever adjective you want to use, is not in the equation. It's a matter of they have a higher authority, and we and our providers, in this case, UMMC and Rochester General, have been answering survey questions by the state as to what resources they have and how those things may or may not be deployed. But by the same token, it's not a Marshall Plan implementation that we're facing at the present time.
That's correct, Jay. On our understanding, I mean, again, we can't. I mean, they're going to come get them, and that's what they're doing with redeploying these resources. Again, it's something I think we need to push back from a policy position, a legislative position as best we can. But in the end, it's something that we're going to have to, I guess, figure out how the governor and the state's going to move forward with that.
Well, before we wrap up, I'll just one other question. I am concerned about the impact to people's physical beings with their being anxious and nervous and worrying about whether or not they're coming into contact with COVID-19 and whether or not they are positive for COVID-19. What are some simple, easy steps that people can take for their own good physical health?
Yeah, I mean, absolutely. So, I just talked a little bit about the anxiety and just, being cooped up and people with concerns. And, we would encourage folks, I mean, you can get out and take walks and still maintain distances. You can do different activities around the home, right, that, may challenge your mind, whether they're puzzles and games and other things that used to be back in the old days, right, with different, family at safe distances. So, this is a time where I think there's an opportunity to reflect a little bit and to kind of maybe move away from some technology, go for walks around the neighborhood, some green spaces that are around, again, maintaining those social distances. Talk with friends and family. I had the opportunity to do a large Zoom meeting, so to speak, Zoom chat with family from around the country with about 20 of us the other night. Something that we typically don't do, but it was an opportunity, to talk and laugh and share stories and reminisce a bit. So, I think there's some silver linings in all this where we have opportunities to connect in different ways. And, again, we want folks to be creative and come up with different things. Maybe share them on your Facebook groups of people of different ways you're managing and getting through your COVID-19 quarantines and isolations and this social distancing that we have to engage in. But again, mental health and making sure that we're cognizant of where we're at and not getting too anxious and getting into depression areas and different things is very important. Which is why, again, if you're feeling that way, we really want you to reach out and talk to somebody that can help you through those difficulties.
And Paul, some of those items are on the press release that you and Tim Yeager are putting out every day with regard to both state and local resources in terms of mental health and counseling and other things of that nature. And our NISAC organization has put together the general outline and the notion of Take 5. reach out, talk to somebody, deconnect temporarily from whatever it is that's maybe putting you in a stress situation. Talk to somebody, reach out to family, take a walk, things of that nature. Kind of like a pause, not the kind that the governor necessarily is talking about, but in general, so that you have that perspective on what's going on around you. And again, the logo that NISAC has put together, and I think even here locally, we're going to try to play into that more, is the idea of taking 5 during your normal day, whatever that may be in the new normal, and help yourself maintain some kind of equilibrium.
Okay, I think that we'll be wrapping it up here. So again, we're encouraging folks to continue to practice your social distancing, check in on your neighbors from a distance, and be safe, be healthy, and be well. Until next time. Thank you.